Hi, I'm Dr. Rovetti, chiropractic physician, designated impairment rating physician, state of Nevada. Today I'm going to talk about the ranges of impairment within the DRE categories. For example, for the cervical spine, if there's a category 2 impairment, it's anywhere between 5 and 8%. And there's always a lot of question as why someone would get a 5% versus 6, 7, or even 8%. And I'm going to clarify that a little bit here today. The rule of thumb is that all of a rater's cases should have pretty even distribution of 5, 6, 7, and 8%. And so with that in mind, there should be 25% in each one of those categories of patients. Another rule of thumb is that the level of impairment within those ratings depends on the patient's problem with activities of daily living. And so if they're having a hard time getting back to work, they're having a hard time putting their shoes on, or any type of activity of daily living, then that should be considered in this. Now, each one of those categories assumes there is some activity of daily living problems. So just because the patient has one small problem doesn't mean he gets bumped up to an extra percentage point, because each one of those sections has a built-in certain activity daily living problems. Something that I found useful, and that's contained in the 6th edition of the guides, is the pain disability questionnaire. And with that, the patient tells you by filling this form out and putting a mark on those lines, all of his problems of activity to daily living. And then you can actually make a numerical assessment of that. And each one of those categories, if you go through the 6th edition of the guidebooks, they don't use that to rate them, but you can kind of see where where mild, moderate, and severe activity daily living problems occur. And so that's a good tool to use, and to see where points can be added or if they should be added. And that's basically it for those 4 points, extra 3 points possibly. And I'll download this form, and if you would actually like to use it, either take a look at the 6th edition guidebooks or let me know and I can email it over to you.